It's day 66 of the coronavirus pandemic in America, and everyone wants to know, when will it be safe to go out again? President Trump says he hopes to reopen our country to business by Easter, while this week we've had our deadliest days yet, leaving many asking, is it the health of our economy or the health of our people that will decide when we go back to work? Our guest today says we don't have to choose. We can optimize the public health response to save lives while minimizing economic harm at the same time. We're getting into it today, but first, here's the latest.
I don't really care if I get in trouble for speaking to the media.
This is Elmhurst Hospital ER Dr. Colleen Smith. She gave this footage to the New York Times.
From the president to the head of health and hospitals saying things like, we're going to be fine, everything's fine. And from our perspective, everything is not fine.
Her message is being echoed by healthcare professionals across America. With a dramatic spike in U.S. cases, our hospitals are starting to feel the impact. A 48-year-old nursing manager has died of coronavirus at one New York hospital, where staff opted to wear trash bags due to a lack of protective gowns. This hospital in Queens, New York, saw 13 people die from COVID-19 in just 24 hours. Now, a parked refrigerated truck outside their ER is a makeshift morgue. Colleges everywhere are turning empty dorm rooms into housing for infected patients. In New Jersey, an entire nursing home emptied and relocated when 24 patients came down with coronavirus. And a new hotspot, New Orleans, where crowds gathered just 4 weeks ago for Mardi Gras. The state of Louisiana posting huge day-to-day increases. 65 dead, 1,795 cases. Joining us via Zoom is former director of the Centers for Disease Control and Prevention and the president of the health initiative Resolve to Save Lives, Dr. Tom Frieden. Dr. Frieden, you oversaw our nation's response to Ebola and the swine flu. What is it about this virus that caused this wild, unprecedented pandemic? Why is COVID-19 the one?
COVID-19 ends up being more infectious than the SARS virus that caused the problem 17 years ago, and far more deadly than the average flu season. We don't yet know how much more deadly and how much more infectious, but right now, particularly for people who are over age 60 and have underlying conditions, this is a really dangerous virus.
Where are we right now on the infection curve as you see it?
It really depends on where you are. Different parts of the country, different parts of the world are in different places, and each different place needs to manage it differently because of that. Where I am now in New York City, unfortunately, we are in what is called the acceleration phase of the pandemic. Sadly, cases are continuing to increase rapidly. And the people who are very sick today, these are people who were infected 10 to 14 days ago. So we're likely to see continuing increases for the next week or so until the impact of our physical distancing can be seen. And that's crucially important because the more we stay away from each other, the more we tamp down infections, the less will overwhelm our healthcare facility and our doctors and nurses.
So I recently questioned President Trump about his pledge to reopen our country by Easter. In your opinion, is it possible we could be ready by then?
Different parts of the country are going to be ready at different times. But here's one thing that is very important to understand. There are two different reasons why we shelter in place. One of them is to flatten the curve, and I think people understand that now, try not to overwhelm our healthcare system. But the second is just as important, and it's being neglected. It's so that we can scale up both our healthcare system, so we can increase that bar on how many people can be safely treated, and scale up our public health system so we can do contact tracing, testing, isolation, quarantine on a large basis so that when we do come out carefully, what we need to do is not open the floodgates, but gradually turn the faucet. When we do come out, if there's another spike, we can then turn it back off so we don't overwhelm our system, infect our doctors and healthcare workers, and lose people whose lives could be saved otherwise.
So, Dr. Frieden, you've been critical of the Trump administration's early response to the crisis. You called it squandered time. Are they squandering time now in getting the much-needed medical supplies to healthcare workers, especially the protective gear?
We really need organization here. It's absolutely the case that industry is willing. They need to be carefully organized. The way to manage an emergency is what's called an incident management system, where everyone has a clear role, where there's someone clearly in charge, and where your top experts are involved. The thing that is most concerning to me is the lack of involvement and centrality for the Centers for Disease Control and Prevention. These are the country's leading disease fighters. These are our public health experts. There are 20,000 people there who dedicate their lives to keeping Americans safe. And frankly, they appear to have been sidelined. They need to be at the decision table and at the podium, both helping to make the decisions and helping to communicate the decisions. And that not having them there is making all of us less safe. It's like fighting with one hand tied behind your back.
So I've been reading a lot of your writings, and you argue the ideal pandemic strategy, the one you've laid out, involves widespread testing and rapid contact tracing. So in our nation's epicenter, New York, they're no longer able to do either of those things anymore. So what do we do now?
What we've outlined is a strategy. This is a war. It is a war. I'll call it World War C. It's all of us everywhere in the world against the coronavirus. And what we need to do is to look at it in different phases. When it's first coming into a community, you do everything you can to try to prevent it from getting out of control. When it does get out of control, and that's frankly what's happening today in New York City, you need to mitigate the damage. You need to manage it, tamp it down as best you can. And in that situation where we are in New York City today, we're strongly discouraging individuals with mild symptoms from getting tested. That may sound counterintuitive, but there are clear reasons. If you go to get tested, you might infect somebody else. You might infect somebody along the way or in healthcare. You're going to use up scarce resources, not just test kits, but protective equipment, doctor and nurse time, swabs, and other things that other people need more than you. And perhaps most importantly, it doesn't matter what the result is. You're going to be told to do the same thing. Stay home and don't infect anyone else. And what's worse, if you're not infected to begin with, you might get infected when you go out to get tested. So that's for today in New York City. For much of the country, the opposite is true. We want everyone to get tested promptly so we know who's infected, can trace their contacts, find out who they are, and isolate them. There are some tough questions here. Currently, we're saying in the US, if you're sick, go home and isolate yourself. Several countries have said, no, if you're sick and you're not needing a hospital, go to some place, maybe it's a dorm room, maybe it's a hotel room, where you are alone and not going to infect anyone in your family. But certainly if you are sick and you're home, look at cdc.gov. There's really good advice there for how to protect yourself and your family, because you need to physically distance. You need to be careful about things like bathrooms, shared utensils, anything that might spread virus. You, if you're feeling ill, should wear a mask, anything, a bandana, a scarf, anything over your mouth and nose anytime people are around you.
Let me just, if I can, push a little bit on this topic. So if the country's in different places, is there any rational argument for why we would allow the parts of the country where there's not widespread infection present, like in New York, to return back to work with the kinds of containment strategies that you've outlined, while at the same time quarantining New York, California, Washington State, areas that have been hard hit? Could that possibly work in a country which has open borders between states?
It's going to have to be a response that's specific to state and locality. Each community will be different. The key is that the federal government develop, with CDC's input, clear, rational, understandable, practical, useful guidelines for when to loosen the faucet and how. And that means looking at the local spread of the disease. That means looking at the local healthcare system, the local public health system, seeing then who comes out first. Keep the people who are medically vulnerable, over 65, heart disease, lung disease, diabetes. They may need to stay in for much longer, but other people, starting gradually, can come out. That's going to have to be done carefully and monitor it. As you know, I've known you for a long time. Let me tell you the key secret to a great response to an infectious disease emergency. It's the use of real-time data to make real-time decisions. It's not saying in advance, we're going to do X or Y, no matter how good that plan is. It's looking at that data and using that data to change how you function, to change the decisions you make. And it's sharing that data openly with people so they can understand it and say, yes, this is the decision being made and this is why it's being made.
So Tom, just to get practical, if we open the faucet solely, for example, what opens first? The schools? Do the kids go back? Are there businesses that you think are easy to social distance in? How do you triage this? How do you stagger it?
There are a few things you could do. Daycare is really important so parents can work, whether they're working from home or at school. And young kids don't appear to get severely ill here. You have to be careful with that because if they're going home and spreading it to their grandparents, that could be a big problem. And one of the things we don't know is whether kids commonly spread this infection. But you could have, for example, workplaces open with staggered shifts, with partial reopening. You could require that everyone coming in the door has hand sanitizer and temperature check. You could make sure that only people who aren't medically vulnerable come out first. We don't know whether this infection causes immunity, but if people have had it, they may be better protected and maybe they can go out more than others. These are all things which we need to learn more about so we can function more to basically have the two things that are crucial: reduce the health harms and reduce the societal disruption.
So Dr. Anthony Fauci has pointed to more cases being present in the southern hemisphere where temperatures are already dropping. It's becoming their winter as a sign of COVID-19 could be seasonal. So if it ends up being cyclical, and a lot of folks, I think you as well, believe this is an endemic virus that's going to be around, then it's going to return. So what unique challenges will that pose to us?
We don't know what the future will hold with this virus. It is new to the world. And I think whether it's the temperature in the southern hemisphere that's affecting this, or just the fact that it's just getting there now, it's traveling around the world, we don't yet know. But we do know that it may be with us for a good while. That's why it's so important that we continue to work on treatments and find out with really rigorous, controlled clinical trials what works to reduce this infection and improve outcomes, to try to find a vaccine, understanding we may not succeed, but we've got to do everything possible to try, and to adapt our response as we learn more. What we think would be kind of a not great, but best case scenario in the current environment is that we tamp it down enough so that if there are flare-ups, we can quickly respond to them and control them before you get the kind of explosive spread that you saw in Wuhan, China, in Italy, and sadly today in New York City.
You know, you become a tip of the spear for this argument that we could take a surgical approach to getting the country back on its feet. And a lot of folks are worried about about whether we're going to track the economy or track people's health when we decide to get back up. What has been the response to your arguments that you could stagger the recovery, that you could get parts of the country up by opening the faucets slowly?
I think we'll have to see what happens. And the key is to monitor what happens, whatever we do, and adjust our response. There's no perfect response here, but there is a best approach. And the best approach is to use the best available data, get the Centers for Disease Control central to the response so they can guide and understand what's happening, answer some of the most important questions that we don't know the answers to, such as, do kids spread this? So we can adjust our strategy, adjust our tactics, and make steady progress, reducing the health harms and reopening our economy.
One more question about Dr. Fauci. He's been talking a lot about vitamin D and about your interesting insights about him, actually. What have you learned about something we get from the sun that most of us don't have this time of year?
I'll tell you a story. When I was working in India for 5 years, we noticed that we were running out of anti-tuberculosis drugs. I worked on tuberculosis there. It happened one year, happened the second year. The third year, we realized there was a pattern. There was a big spike in cases in the winter months. And we didn't know why that was. Maybe there was more crowding, maybe people were coughing more, so they were diagnosed more, maybe it was vitamin D deficiency. That was a couple of decades ago. And we wrote that up for the Lancet Medical Journal. And in the last couple of decades, there have been a series of studies that do suggest that people with lower vitamin D levels are more likely to get respiratory infections, including tuberculosis, influenza. Now, as an acute treatment of someone very ill, it doesn't appear to work. But if you have good stores to begin with, meaning take one multivitamin a day with between 800 and 1,000 or at most 2,000 units, don't take more because it's a fat-soluble vitamin that you can overdose from. You can get too much and get very sick, but take enough. And if you can get outside, 15 minutes of sunlight a day makes a really big difference. It's something that almost certainly can't hurt if done correctly, and it might help.
Do you take vitamin D yourself?
Yes, I do.
It's good to know. Tom, thanks very much for joining us. I appreciate it. Thanks for all you're doing.
Thank you. Great to speak with you again.
Up next, what can we do to mobilize more healthcare workers during this pandemic? We'll be right back. Be sure to subscribe to my channel so you don't miss anything. And remember to check back often to see what's new.